You're watching KCAL 9 News at 2.
As the weather cools down, joint pain is going to get worse for a lot of people, especially athletes.
But there are some things that you can do to keep your bones strong. Dr. Armen Hagopjanian is with us now. He's going to share some tips. Welcome, doctor.
Thank you very much for having me.
It's about that time of the year, huh? Starting to cool off.
Just about when everybody in the store will go and running after these wonderful drugs with Motrin, Advil, and every possible anti-inflammatory they can find. But you can probably save some money if you actually have a problem, because these drugs will take care of your symptom, which is the pain, but usually wouldn't take care of your problem, which is usually the arthritis.
So should we resort to these first, and if the pain persists, then go see a professional?
Well, you know, I don't like the self-medicine part of resort to this first. I think you should ask for a professional help. It can be the naturopath, actually orthoped, or the primary care physician, where everybody goes to first. However, if you do have a problem, obviously you need to see a surgeon who can actually fix the problem, so you do not have to keep taking this medication for the rest of your life.
How do you know when it's something serious and not just the normal achy pains of getting older?
Well, first you go to school for 10 years, then you go to residency. No, in reality, if there is a true arthritis, if there is a loss of the cartilage, if there is a bone-on-bone contact, usually people will have pain no matter how much medication they're going to take. And today, almost everybody heard about the total knee replacement and total hip replacement, and not many people actually do total ankle replacement. Ankle replacement was actually first introduced about 20 years ago, but because of the poor implant design, people were failing right and left, and so this big motion in the medical community was don't do that. But the most recent developments in the surgical technique and technology advance, we actually can do this better, we actually can do this more and more successfully. So today there are 4 different designs available in the US market. One of the most favored is probably the STAR design. STAR design called Scandinavian Total Ankle Replacement System, which is the only mobile bearing implant on the market and allows the proper range of motion of the ankle. You can see how easily it moves. So 99% of the surgeons would probably offer patients some fusion of the ankle, which was a standard of care for many years. But now, these days, when you actually can preserve the range of motion of one joint, it actually allows you to preserve the range of motion of other joints and actually functionality. People play golf with these joints. People actually run marathons with this. I wouldn't say they will be able to professionally play for Los Angeles Lakers, but I think they can do their own
Not many of us can.
I guess eating right is a good place to start too, huh?
Absolutely. Before you actually get to this stage, you actually have to learn that not all of us will stay 18 years of age for the rest of our lives. And especially in women's health, when they go through different hormonal changes through their lives, they actually do lose a lot of calcium. So the proper eating will probably be very important for the health. I'm a surgeon. I always recommend to eat well, but probably the primary care physician will help you a lot more than me. However, milk will help you a lot. A lot of dairy products will help you a lot. Broccoli actually will help you too. Obviously, there's some wonderful yogurt and stuff, but any dairy product will help you a lot. Many people reserve to always supplement their food, but I think there's nothing better than actual natural fruits and vegetables, of course, if they are not genetically modified.
And you say it's important to get outside as well.
Absolutely.
Get some sunshine.
Most of our vitamin D actually comes from the sun. So that's why we usually keep our babies out. We take them out so they can see the sun. I'm not suggesting going laying on the beach for hours, because then you're going to develop skin cancer. But a proper amount of everything is good for our health. Anything in excess will always become a poison.
And you say also that you should I was just reading somewhere where there's actually almost an epidemic of lack of vitamin D in people because of the not enough sunshine. We're spending too much time indoors.
Well, you know, I grew up in the Soviet Union, and we always remember the commercial when our generation chose Pepsi. I think new generation has chosen Facebook, and they constantly sit in front of the computers. I think we have a wonderful diagram here with about the good posture is actually sitting in the computer. I think that person was sitting there for 30 years looking at the size of the monitor. I think that's the monitor of 1980s or something like that. So people need to go out. People need to go out. People need to socialize. People need to see some sunshine, go to the beaches, and obviously we are overwhelmed with the work, with studies and stuff. But I think there should be some more communication between human beings, except for the Facebook and Twitter.
Good advice.
Thank you, doctor.
Thank you, doctor.
For more information, just go to our website. It's kcal9.com. You can click Seen on TV.